In news now that we probably all expected, I have had confirmations from many places that Mediclinic has decided that they will mandate vaccines for all their staff, not just for the doctors, but for all staff within the Mediclinics. And the memorandum that was written on the 29th of September, which was yesterday, says Doctors and Healthcare Professionals Memorandum. Dear Doctors and Healthcare Professionals, planned introduction of mandatory vaccination policy. So it does say planned introduction of mandatory vaccination policy. So they're planning on doing this, okay? And they probably want to test the waters and see how the people feel. And they say, as one of the leading healthcare providers in South Africa and Namibia, Mediclinic South Africa has made an in-principle decision to implement a mandatory COVID-19 vaccination policy for those working within all Mediclinic hospitals, offices, and subsidiaries. Mediclinic's aim is to create a safe and positive environment for the treatment of our patients as well as for our employees, associated doctors, healthcare professionals, and other service providers. We strongly believe that this is the right decision based on the following key considerations. Number one, it is the right thing to do, they say. Now, that is a propaganda statement. That is not a factual statement. That is an opinion, and that is why it is clearly a propaganda statement. Now, they say here the COVID pandemic has created unprecedented public health and workplace challenges, and we are faced with a global crisis that necessitates decisive actions. Factors that were taken into consideration when making this decision include the likely duration of the COVID-19 risk, the nature of healthcare as a frontline industry, the nature and severity of the potential harm, the likelihood that the potential harm will occur and the potential harm to patients, the availability of COVID-19 vaccines, and the ability to curb the mutation of the virus. And then they say we have to limit the impact of COVID-19, continue the review of leading studies that relate to the effectiveness of vaccination clearly shows that the vaccine reduces COVID-19 related hospitalizations, deaths, the severity and duration of the illness and the virus's transmissibility to a significant degree. I don't know what that means, significant degree. Vaccination will further relieve the pandemic's current burden on the healthcare sector. And this is what our government's main premise was with flattening the curve. It is our moral obligation, okay? As a frontline health care provider, Mediclinic needs to remain more vigilant than most other businesses in our endeavors to protect our patients, employees, associated doctors, other healthcare professionals, service providers who come onto our premises, as well as the general public entering our facilities, okay? Professional organizations such as the South African Nursing Council, the South African Committee of Medical Deans, and the Health Professionals Council of South Africa endorsed the proposition that healthcare workers and organizations have a professional and ethical responsibility to help prevent the spread of infectious pathogens, including COVID-19, which is a disease, not a pathogen, among patients, colleagues, and their families and the related communities. Mediclinic's purpose is to enhance the quality of life. Implement of this policy aims to support our core purpose to ensure a safer environment for the treatment of our patients. In line with our value of mutual trust and respect and the current public health imperatives, we will implement this mandatory vaccination policy to promote Mediclinic's obligation. Now they are saying that they will implement it. Okay? Earlier, they said planned introduction of mandatory vaccination policy. So, then they speak about the legal stance on the mandatory vaccination policy. In the South African legal context, an employee is obliged to ensure a safe workplace. We believe that this policy promotes the rights of all employees to a safe working environment and supports Mediclinic's legal obligation to provide a safe workplace in accordance with the South African OSHA Act. The policy also supports our legal duty to provide a safe environment for our patients and all other persons coming onto our premises, including doctors and healthcare professionals. In addition to the aforementioned, on 11th of June 2021, The South African Minister of Employment and Labour gazetted a directive on COVID-19 vaccinations in specific workplaces in the Consolidated Direction on Occupational Health and Safety Measures, requiring employers to assess and determine the necessity for mandatory vaccination policies taking into account the specific circumstances of the workplace. What this basically means is that the government started this nonsense, okay, that takes your freedom to choose away. They are the people that kick-started this, and now they're sitting back and watching what companies end up doing, and the companies now will end up with litigation, as many of them have already. And to me, that is cowardice by the president and the ministries. The principle espoused by the directive is that employers and employees should treat each other with mutual respect. That's an oxymoron in this case. Essential considerations are public health imperatives, employees' constitutional rights, and efficient business operations. The position of a mandatory vaccination policy has been vetted extensively. Mediclinic engaged widely, obtaining input from various experts. Our independent policy is justifiable given the public health crisis and the overwhelming proof that vaccination is the most effective step that we can take to protect ourselves and others against COVID-19. Now, have they proven to their staff what they are saying now? They are making statements. If they prove this to their staff, maybe they can get buy-in. Just like if the government proves certain things to the citizens will have buy-in if they can prove it. 3. Implementation and scope, and this is the key. The mandatory vaccination policy will be implemented amongst our staff on the 1st of October 2021. That is tomorrow, and will be rolled out in a phased approach with a due date for compulsory vaccination of 1st of February 2022, which means all employees will need to be vaccinated in full by this date. Now, in full means with Pfizer, 2 vaccinations, with Johnson & Johnson, who knows how many it will end up being. Like in Israel, Pfizer is already at the 3rd dose and are speaking about a 4th dose. Mediclinic is cognizant of the religious and cultural freedoms of our employees. Mediclinic has endeavored to balance our employee rights by accommodating reasonable exceptions for those unwilling or unable to be vaccinated. The details of the rollout to associated doctors, healthcare professionals, and other service providers is currently being developed, and more details will be provided soon. We would like to thank all our associated doctors and healthcare professionals for the support during our vaccination program. We trust that you are aligned with our vision of creating a safer and healthier future within our Mediclinic communities. Well, they should know how many of their staff have been vaccinated to realize that that is not the case for the majority of South Africans. And they will feel the brunt of this. We will communicate further as the process unfolds, and understand that you may have questions in this regard, which you are welcome to direct to the hospital general manager at your locality, who will ensure that it reaches our team. Mediclinic views this policy as a critical step to provide a safe environment for patients and everyone working at our premises. We value and appreciate everyone's positive support and cooperation in this process as we seek to make significant impact in reducing the further effects of this pandemic on our society and our operations. And this comes from Kurt Pretorius, Chief Executive Officer of Mediclinic South Africa. Kurt, you are now going to have to live with the consequences of your decisions, and let it be as it may. Face those consequences. It's all part of your liberty to make a choice to implement something like this, and live with the consequences. Enjoy them. Thank you very much. Till the next video.